Welcome to Get Real, How to Live a More Authentic Life, with psychologist and author of over 75 books, Dr. Barry Weinhold.
Welcome back, everyone, to Get Real, How to Live a More Authentic Life with Dr. Barry Weinhold. My name is Ashley Ross. Dr. Weinhold, how are you today?
I'm grateful as usual.
I love it. Anything new and exciting that's happened since we last spoke?
I don't know. I sometimes suffer from the midwinter doldrums,
Me too.
and I'm in the midst of those right now. I think, and I'm a big sports fan too, and football's over, and basketball and hockey, which are the other two sports I watch in the winter, it's about halfway. And so it doesn't get exciting until the end with either one of those sports. And so I sometimes don't even watch them anymore. I think, I'll wait until when they get closer to playoff time, and then I watch the playoffs.
That is the most exciting part, it seems. So what do we have this week?
Well, I'm going to answer the question. Actually, make the statement that there's nothing wrong with you. And how can I make such a stupid statement? Well, I believe that we have been conditioned to think that when we have symptoms like this second belief that of my top 20, put the list up there. Yeah. If I'm depressed or anxious, that means there's something fundamentally wrong with me. This is the belief that I see all the time in my clients when they come to see me on BetterHelp, which is an online counseling service that I am participating in. And but I don't ever want to deal with that, because what that amounts to is they're coming with a lot of shame, because shame is there's something wrong with me. Guilt is something I did something wrong. Much different way of, and shame is probably the most difficult feeling to change and overcome. So I'm basically talk to my clients and I say, I say, well, I got to get this client through the shame barrier before we can do anything productive. So I'll say to them, I don't believe there's anything wrong with you. I'll look them right in the eye and I'll point to them. I say, there's nothing wrong with you, and I'm not here to fix you. Then I talk about why I'm here and what I do, and I'll talk some more in this episode about that. But I do think that the whole idea that belief that if we have symptoms, that means there's something wrong with us, and I don't go by that, and they're because I look at symptoms as simply just unfinished earlier learning experiences that now will show up to get finished. That the natural learning style of human beings is to finish things that are unfinished. And so when you get triggered by a memory of something in the past and it disrupts your life, and you have these deep feelings and you don't know what to do with them and you don't know where they came from, it can be a bit scary. Yeah. And people often, if they don't understand that their natural impulse is to do something to get these feelings calm down, get these feelings calmed down, and get back to what I was doing before I had these feelings. So have you had that experience?
All the time. I'm getting better about it now. I've learned a lot more tools. I don't think I had the right tools to help me process and finish those things. So
Yeah.
that's definitely important.
I mean, the two tools you need most is the ability to self-reflect and understand. Okay, ask the questions like, what is behind this? Why am I doing this? and what could this connect with from my past, and then have tools and skills to what I call self-correcting skills, self-reflecting and self-correcting skills are the two most important skills that you have to have. And so when you have those, then you can make better use of when you get triggered and what kind of things that come up. And unfortunately, until you do the self-reflection and the self-correction, things will still keep coming up because they're not finished. Human beings like to have everything finished and completed, but that's also what our body wants. Because if there's something in our body memory that's unfinished, it causes some tension in our body, and that may be the biggest reason why we don't live to our what would be our biological prediction. Well, all the species in the biological world, there's a formula. It's the time from the time you were born until you can reproduce times 20. And every species in the biological world, mostly mammals, um, conform to that formula. And so the only one that's an exception is humans. If we lived according to our biological program, we would live to be 200 to 250 years old. I mean, that's what I mean. If you take the formula from the time you're born to the time, how many years it takes until you can reproduce, and for women, when they get their period, they can reproduce. Well, when do women get their period? Well, sometimes it's longer than others, but it's usually around 12, maybe 13 or 14 sometimes. And take that times 20, and that's what our lifespan should be. Now, the Bible records that people at certain times in our past lived that long, and we always look at that and say, "Oh, that can't be. They sort of made that up." But no, they didn't. And life may have been more simple then, and less stressful, and maybe they also had better parenting than we do now. I don't know, but anyway, the whole idea is that whatever we didn't get finished as a child will continue to show up to get finished, and that's just the way it is. And if the more you understand that and how to use that to your effectiveness in effective ways, you, the better your life's going to be. So I don't even talk about trauma anymore. I used to be an expert on trauma. I don't even use the term anymore. I just call them unfinished life experiences where something happened to you or didn't happen that's had long lasting effects on your life. And the research, I often try to get back to um, infancy, because what the research shows pretty clearly is that as an infant, whatever happened or didn't happen to you as an infant forms the template for the rest of your life. And you will recreate it actually in adult forms, but it's the same pattern that happened then. But who remembers what happened to them when they were an infant? No one. And so you have to rely on kind of going backwards, what's happening now, and looking at how that resembles what could have or should have happened or was happening in your bonding process with your mother. And the research on that is that about half of the infants in this country leave infancy with a secure bonding, and half don't. So people, and it's pretty clear that the people who go to therapy, about 80 to 90% of those who didn't get secure bonding, people with secure bonding don't usually show up in my office, but those who didn't. So I start with trying to get them back to the original source of the issues that are showing up right now. And almost every case I can get people to understand how they connect. to connect the dots between those. And so that's what I really spend my time doing with people, and I really find that to be a very useful and rewarding. I mean, people get it, and when they get it, they take it and run with it and make huge transformational changes in their life. And it doesn't necessarily have to happen early, although it is happening earlier with people, and that's encouraging. Most of my clients are under 30, and they come to me and they say, "Doc, my life isn't working. Can you help me?" And that's an open door then to and then of course first thing I tell them is there's nothing wrong with them, and then we go from there. But the whole idea too of what traditional therapy seems to claim as their success, I question that. I question whether it's only the placebo effect operating again. Do you know what the placebo effect is?
Um, where the brain kind of tricks itself into thinking that it's had what it needed, even though it didn't.
That's right. Well, this actually started in a company, the General Electric. I believe it was in Schenectady, New York. They plant. The workers complained that the lighting wasn't bright enough for them to do their work, and so the company hired this group of people, came in with their step ladders, and they went up and they ostensibly changed the wattage in the bulbs, but they didn't. They kept the wattage the same. And by the fact that they went up there and did this, it convinced everybody there that the lighting was now great. And that's called the placebo effect, or sometimes called the Hawthorne effect, because the people, I think the Hawthorne, I forget how that got that name, but it was related to that initial incident of the placebo effect. And in every kind of uh, double blind, absolute tight scientific research, they always control for the placebo effect. They have a group of people that they pay attention to, but they don't give the treatment to, or that uh, uh, they have a sugar pill that looks like the pill that they give the one that they treat to, and then they look at the results. And in almost every study, the placebo effect comes just about 10% lower than the treatment effect. And so most studies will live with that because they know it's going to happen. They just have to have some data to prove that they were able to do better than the placebo effect. Now, why is that? It's because when you pay attention to people in a positive way, they get better. And so, if doctors had more of a bedside manner, probably they would help their patients more than the medicine they're giving. But most doctors don't, and they try to see 4 patients an hour, 15 minutes at most at each, and so there's no time to to really get to know the patient and give them the attention they really need. And so the placebo effect is a truth, and it's a reality, a fact that conf- uh, confounds a lot of research findings. And I think in terms of therapy, it might be even more pronounced because there you have somebody who's giving them a lot of effect. One-on-one constant attention, and so that has to have some effect on people getting better. Just to have somebody to sit and talk to about I mean, they've done some research about that. They did one research about people with that needed to forgive. How'd this go? I think it was like they had people talk to somebody behind a curtain. There was nobody there, but they verbally said that they forgave somebody that they had some grudge against, and just the fact that they voiced that, and there was somebody, they thought there was somebody listening to them, but there wasn't. Had a positive effect on them. So that I think is something we have to take into account in looking at evaluating the effectiveness of our systems that operate on. I mean, even if you look at the kind of our government systems, And I mean, when you interact with a government agency, how much do you feel like you're really important to that agency? They missed the boat. If they just paid a little bit of attention and gave you a little bit of sense of how important you are to them, it would make a huge difference in the way people perceive government and way what they would get out of it. And so it's again, if people were more psychologically intelligent, they would know how to do those things, and they would do them consciously because they knew that they would help people and make people feel better and get better. So that's, I think, one of the things I'm really focusing on in my work. And um, so I wanted to talk a little bit more about this whole idea of uh, the the thing about the default system that people have. And because we have grown up with certain beliefs and certain patterns of behavior that are operating in this default setting, we don't do much self-reflection on things. So if we feel anxious or we feel depressed, we don't know why. We don't have any clue about why. I mean, you can probably sometimes guess what might making you depressed if there's something happened that is, making you feel sad or a loss of some kind. But until people have an understanding that these are just simply things that are coming up from your past, that that you will have to find a way to deal with them, or they'll keep coming up. They won't go away. So what I do is I use a lot of self-assessment inventories that people fill out. And then I go over the items that they mark 3 or 4. And a 3 means this is something that's happening usually in their life, or 4, which means almost all the time. There's not much difference between usually and almost all the time. So I combine those two. And we go over the item and I say, okay, how is this affecting your life today? And they tell me. Then I say, okay, where do you think this started? Where would you say that what happened or didn't happen to you that somehow is connected to how this is affecting your life today? And we do some what I call personal archaeology to see if we can find out. Sometimes I get lucky. One client, I had him. I said, "How are you feeling about what's going on in your life today?" And he said, "Well, I feel helpless." And I said, "Okay, close your eyes and locate that in your body." And he did. And he said, "It's here in my heart." And I said, "Okay, well, open your eyes. Now close them again and feel that feeling in your heart. And tell me the first time you ever felt that way." Within 5 seconds, he had it. He said, "I was watching my parents having a fight and I felt helpless. I was 3 years old." And there was the source of all of his anxiety. He had tremendous social anxiety. So anytime he was with people, he he was hyper vigilant. He was afraid that somehow there'd be a fight again, and he would feel this helplessness. So to defend against that feeling of helplessness, he just avoided all social situations. And when he was in them, he was highly anxious and hyper vigilant, waiting for something bad to happen. And so then after I do that, and after they've identified that, I say, okay, you didn't have a lot of resources back then when you were 3 to do anything about that situation. But what was missing? Well, I never got to say to my parents how that affected me, which is a huge missing piece. So I said, okay, when you're now an adult at your age, you can say that when something happens that affects you, you can tell people how it affects you. And that's getting your voice back. So that is one of the ways that I work with people in terms of looking at how it's affecting your life today, where did it start, what was missing, and what you can do today to finish whatever is unfinished about it. And it's a fairly easy formula to follow. it's pretty concrete, and leads me then to giving a lot of homework assignments to clients. Okay, you can do this now, so go out and practice that.
Hmm.
Get into some social situations where you have to practice, and report back next week how it goes. So that's kind of where I am with looking at symptoms as meaning that there's something wrong with us. It simply isn't true. The truth is that basically we're just using our natural learning style as human beings to try to figure out how to finish things that didn't get finished in the past.
Hmm.
And our body helps us by triggering us a memory of those things when something happens in our current life that resembles that in some way. And our body kind of has a checklist. Okay, we'll check that one off. So once you finally have finished it, then it goes as a part of that, maybe that default setting, but it's no longer stressing you in any way. It's something that's already learned and you can count on it in the future. And so that's how I see people getting better in life. And again, with the current mental health system, it doesn't seem like it's likely that's going to happen in therapy, in the therapy that I. So what needs to happen? Well, we need therapists that are better trained at asking the right questions. That's simply what it is. That know how to help people access the memories that are coming up and triggering them, and figuring out what those memories are about and what's not finished about them, and then helping their clients learn how to finish them. Now, you don't need a therapist to help you with that. You can figure that out for yourself if you have some self-reflection and self-correction skills. Come back to those two core skills again. So that's what I tend to look at, and in terms of this belief that there's something wrong with me if I have any symptoms like depression or anxiety. It just isn't true. And the minute you buy into that system, then when you go to a therapist and you tell them you have depression or anxiety, what do?
You get labeled that.
You get a diagnosis.
Yep.
Now you have a name for it. You can put it on your forehead and
Yeah.
live with that the rest of your life.
But does that actually help you get better?
It actually makes it worse
Yeah.
because
Then you believe it.
you believe it, and you're off in a different tangent about what's
Mhm.
wrong with me and how I need to be fixed.
Mhm.
And there's nothing wrong with you.
No.
And you don't need to be fixed.
No.
And this is how you can fix yourself, if you want to call it that,
Mhm.
by using these 4 tools. So just how's this affecting my life? Where did it come from? What was missing when it happened initially? What can I do now to finish that and fill in the missing pieces? And then it's done with. It doesn't keep repeating anymore.
Mm-mm.
And
Oddly enough, that's exactly the practices that I've been doing in the last few weeks, and I have felt overwhelming contentment and comfort. Nothing like I feel like I've verbalized that I've suffered from anxiety and depression my whole life, and now I look back on that and I think, why? Because I had this all along. So
yeah.
it's very powerful.
Well, you just increased your psychological intelligence. That's what you did, and that helped you finally figure out what was going on.
Hmm.
And that's what I'm hoping people in our audience are able to do with this information.
Me too.
And also, when my book comes out, to read that book and
Mhm.
learn even more. So the subtitle of it, what is your psyche? The subtitle is Increasing Your Psychological Intelligence Through Self-Therapy.
Mhm.
That I believe everybody can be their own therapist if they have the right tools and the right information. And so that's what I'm banking on. And
Wonderful.
I'll be sharing a lot of things from that book during this whole year.
I'm very excited. I think it's going to be a great year of not just information, but I think everyone will get wonderful things from every one of these episodes that can really help them, like you said, totally turn their lives around.
Yeah, I mean, clearly my clients are doing that,
Mhm.
and yet I'm saying, there's many people out there that aren't seeing me, and maybe you're going into the mental health system hoping that they're going to get the right kind of help and not finding that help. I mean, many of my clients have been through that.
Mhm.
They didn't get help.
Yep.
And so they're finally finding someone who can help them. And it's not, I'm not a rocket science. I'm not anything. I'm just passing on what science has already found to be true.
Mhm.
This is the natural learning style of human beings. That's all.
Well, we thank you for sharing that information. I know I appreciate it.
All right. Well, let's keep working on this, and that's about all I want to say for this week.
Wonderful. Until next time. Thank you, Dr. Weinhold.
Okay. Take care.
Bye-bye.
For more information, please visit the Colorado Institute for Conflict Resolution and Creative Leadership at CICRCL.org or click the link in the show notes.